What if I told you there is one institution in the whole world responsible for coordinating global responses to pandemics, setting international health standards, approving essential medicines lists, and guiding countries through crises like COVID 19, Ebola, and polio? That institution is the World Health Organization, better known as the WHO. But what exactly does it do? Is it powerful? Who runs it? How was it created? And why does it matter for the future of global governance? Today, we're breaking down everything about the World Health Organization. History, structure, controversies, leadership, and global impact. So let's begin. So first of all, what is the World Health Organization? The World Health Organization is the United Nations specialized agency for global health. Its mission is simple, but extremely ambitious. It promotes health, it keeps the world safe, and it serves the vulnerable people around the world. It also coordinates international health policy. It supports countries during health emergencies. It sets medical guidelines, and it also monitors global disease trends. It is essentially the central nerve system of global public health governance. So when and why was it created? The World Health Organization was officially established on April 7th of 1948. A date now celebrated every year as a World Health Day. But the idea emerged earlier. After the Second World War, the international community realized something critical. Health crises do not respect borders. Cholera, influenza, tuberculosis, disease spread globally. A coordinated system was necessary. During the 1945 United Nations Conference in San Francisco, Brazil and China proposed creating a global health organization. The World Health Organization Constitution was signed in 1946 and entered into force in 1948. From that moment on, global health became a structured part of multilateral governance. How is the WHO structured? The WHO operates through three main organs. The first organ is the World Health Assembly, that is the decision-making body. All the 194 member states participate. What this decision-making body does? This decision-making body does. They approve the budget, they set priorities, and they elect the general director. Another one is the executive board, composed by health experts from 34 member states. The executive board implements decisions and prepare the agenda for the assembly. The third one is the Secretariat. This is the administrative arm led by the General Director. It includes thousands and thousands of staff members worldwide. Who leads the WHO? The WHO is currently led by the General Director Tedros Adhanom Ghebreyesus, elected in 2017 and re-elected in 2022. He is the first African Director General in the World Health Organization history. Before him, other notable leaders included Gro Harlem Brundtland, which strengthened the global health diplomacy, and Margaret Chan, who led the H1N1 outbreak and the Ebola outbreak. Keep in mind that the General Director is elected by member states, only by member states, meaning the World Health Organization is intergovernmental, not independent from states. Okay? Another thing you may know is that what does the World Health Organization actually does, right? So, a lot of things that are important for the world. Some functions include public health emergencies of international concern declarations, coordination of pandemic response, publications of essential medicines list, international health regulations settlement, supportment for vaccination campaigns, eradicate diseases like polio, development of global health guidelines, provide and pursue technical assistance to low-income countries, and etc. Keep in mind that the World Health Organization is a recommendatory committee, so it does not control countries. It does not impose laws. It just issues recommendations and coordinates cooperation. Its authority comes from legitimacy and expertise, not enforcement of power. You might also be asking yourself, how does the World Health Organization fund itself? The World Health Organization is funded by excess contributions that are mandatory payments from member states and voluntary contributions that come from governments, foundations, and non-governmental organizations. A fun fact is that the major contributors historically included the United States, Germany, the United Kingdom, and private foundations like the Gates Foundation. You may also know that funding structure has been a source of political debate, especially during COVID-19 outbreak. You may also keep in mind that any institution escapes criticism. During the COVID-19 pandemic, for example, the World Health Organization was criticized for reacting too slowly to the crisis and handling off early information from China. Political pressures from powerful member states, however, it also took place. It was also praised for coordinating vaccine access, providing global guidance, and support developing countries. Keep in mind that the World Health Organization operates in a highly political environment, balancing science and diplomacy. So why the World Health Organization matters for the future of the 21st century? That's because it's so important because in the current century we face problems like climate-related health crisis. We may face future pandemics. We face antimicrobial resistance. We face global health inequality. And we also face a lot of other problems that are very hard to solve. And with that, problems that without a central coordinating body, global response would be fragmented. The World Health Organization represents the idea that health is not just a national issue, it's a global public health good. Global public good. The final reflection I would like to propose is that the World Health Organization is not a world government. It is not a global policy force. It is a coordination platform for 194 countries trying to solve the most complex health challenges humanity faces. Its strength depends entirely on cooperation. In a world where viruses travel faster than politics, global health diplomacy is no longer optional, it's essential. So if you want deep, structured, high-level explanations about global institutions and multilateral governance, subscribe to the channel, because understanding how the world works is power, and global health is one of the most important arenas of international politics today.